Hello. This brief presentation will provide an overview of study designs. Part 1, Quantitative Research. The objectives of this presentation is to provide an overview of the three most common types of study designs applied in nursing research and evidence-based practice, or EBP. Also, to understand the strengths and limitations of each type of study design as applied to nursing research, or EBP. Evidence-based practice is about finding evidence and using that evidence to make clinical decisions. A cornerstone of EBP is the ranking or rating system of classifying that evidence. Nurses are encouraged to find the highest level of evidence to answer their clinical questions. As shown in the image, you can see that the evidence is categorized into three main areas: studies of studies, which is the highest level of evidence, such as meta-analyses or systematic reviews; experimental studies, such as randomized controlled trials, quasi-experimental studies; and observational studies, such as cohort, case control, or cross-sectional studies. While very important and interesting, case studies are ranked the lowest in the rating system. This presentation will provide an overview of three primary research study designs: randomized controlled trials, or RCTs, quasi-experimental studies, and cross-sectional observational studies, as these three types of studies are commonly used in nursing research and EBP. Primary research study designs. So what are the differences between experimental and observational studies? Well, the first thing you need to ask yourself is, are you assigning an exposure? Or another way of saying this is, are you delivering an intervention and trying to change what is happening based on the intervention or exposure you're delivering? Are you evaluating what is happening after you deliver your intervention or exposure? If the answer is yes, you are conducting an experiment. Circling back to the boxes on your left, if your answer is no, and you're not assigning an intervention to a specific group, and you're just watching what happens, then you're doing an observational study. As mentioned previously, there are three types of observational studies. However, this presentation will focus on cross-sectional study design. We will first discuss experimental study designs. And to reiterate, experiments are when the researcher tries to change what is happening and then evaluates what happened. Randomized controlled trials. This is a design where participants, and this can be your patient or your colleagues, are randomly assigned to receive or not receive a specific treatment. And the reason for randomization is to reduce something called selection bias. Selection bias is when the sample does not accurately reflect the target population. In addition, the random allocation, or the assignment of groups, is blinded so as to not compromise the study or introduce differences between groups. This is also known as performance bias. In this type of study design, each group, so the group that received the treatment and the group that did not, are then followed for a set time frame and then compared. So for example, 50 patients with uncontrolled hypertension are randomized to receive an automated blood pressure monitor at hospital discharge or not receive a monitor. At 6 months, investigators evaluate blood pressure control and compare the results in each group. Randomized controlled trials are the gold standard study design. The distribution of the treatment is unbiased, and potential confounders, or things that can influence the outcome, are reduced. Highlighted in red are the cons. This type of study design, unfortunately, is expensive and time-consuming. Quasi-experimental study design. These are not technically true experiments because there is no random assignment. When I say true experiment, I mean that this is not an experiment that you can determine cause and effect. Rather, the study design can demonstrate differences between groups. A one-group pre-test, post-test is the most common type of quasi-experimental study design that we see in the nursing EBP literature. So the outcome is measured once before the treatment and then once again after the treatment. An example would be measuring knowledge scores once before an educational intervention or treatment and then once after the educational intervention. The pros to this study design is that it's feasible, especially when randomization is impractical or unethical. And this study design requires very few resources. The cons, however, is bias. You may have a testing effect or group talk. These are common limitations to this study design. The next primary research study design that I'll discuss are observational study designs. Observational study designs are exactly what the word describes. It's an observation, or the researcher is studying what is happening. As mentioned previously, there are 3 observational study designs, but we're going to focus on cross-sectional study design on the next slide. Cross-sectional study design is a design that provides a snapshot about a characteristic of a specific population or a representative subset, and at a specific point in time. Cross-sectional study designs may be retrospective, so evaluating what happened in the past, but they cannot be prospective, evaluating what's happening in the future. So for example, what is the prevalence of uncontrolled hypertension in emergency patients at Hospital X in 2022? Pros are that you can evaluate an outcome rather quickly, and it is efficient. Cons are that you would need a rather large sample to produce any meaningful result. And this study design does offer correlation, but not causation. Thank you.